Good morning, everyone. Thank you so much for being here today to celebrate the opening of the Linn County Mental Health Access Center. This is the culmination of years of collaboration, cooperation, planning, overcoming challenges such as natural disasters, a pandemic, and creating opportunities to ensure that people with brain health and substance use challenges have a safe, inviting, accessible, and high-quality alternative to the emergency room or jails for services. Access centers are not a new service nationally, but they are a new service in Iowa. For years, law enforcement and emergency room doctors have wanted to divert or safely discharge people away from the jail or the hospital emergency rooms, but didn't have a place to divert them to. Officers and doctors were plagued by the question, safely divert them to what or where? Linn County's Mental Health Access Center answers that question with an array of services designed to meet people where they are at, help them de-escalate, and create a treatment plan after they walk out these doors. I am thrilled that Linn County is one of the first mental health access centers in Iowa that will provide crisis observation, crisis stabilization, a partnership with a residential care facility for long-term brain health needs, a sobering unit, and a medically supervised detox unit, all under one roof. No one entity could have done this alone. In 1975, the late Muhammad Ali was invited to give a commencement address to that year's graduating class at Harvard. At the end of his remark, a student yelled, "Give us a poem." Ali was famous for the poems that he used to taunt his opponents. Ali thought for a second and he said, "Me, we," an expression of the importance of community, an appreciation of togetherness, and the power of collaboration. In that spirit, I want to thank with all of my heart the leaders of the 4 service providers and their staff who will operate out of this center: the Abbey Center for Community Mental Health, Area Substance Abuse Council, Foundation 2, and the Penn Center. I could have not asked for better partners in Kathy Johnson, Jeanette Archer-Simons, Emily Bloom, and Diane Brecht, who are not only experts in their fields, but are passionate about improving the human condition with dignity, compassion, care, and non-judgment. I want to thank representatives from the Cedar Rapids Police Department, Sergeant Chris Bieber, and the Linn County Sheriff's Office, Major Chad Colston, for their early advocacy and involvement in helping make this day possible. My gratitude goes out to both Mercy and St. Luke's Hospital CEOs, emergency room doctors, and clinical staff for their guidance, advice, and support, as well as the staff from Area Ambulance for their shared partnership. My sincere appreciation is also with the members of the Mental Health Access Center Executive Committee, who were integral in creating processes and procedures for the delivery of services, as well as Stacy Mead, Sarah Barrows, and David Thielen from Linn County. I wish to thank my colleagues, both past and present on the Linn County Board of Supervisors, for their support throughout the years in seeing the vision of repurposing the old Linn County Public Health Building into a new space designed to provide a new service with many unknowns. This access center was reverse engineered. We committed to a location, had to find the money, and then had to figure out if it was sustainable. That is not how you would ordinarily create a service, but they believed in my vision for improving brain health and substance use disorder services in our community. I would also like to thank the 9 counties that comprise the East Central Region Mental Health and Disabilities Governance Board for their financial support for 2 access centers in our region and several rural access hubs that will improve how rural residents access critical services closer to their communities. Lastly, I want to uplift Erin Foster, the Mental Health Access Center Director, for taking what was an idea, an empty space, and helping to create what you see here today. Erin came to Linn County from the substance use arena and has a deep well of knowledge into the complex and backwards funding of substance use and brain health programs. She has dedicated herself fully to helping others and has a reservoir of resilience that is necessary to run a program in coordination with our community partners. I couldn't think of any person better suited to run this program than Erin, and I celebrate her success in arriving to this day. 20% or 1 in 5 American adults experience a mental health issue each year. 5% or 1 in 20 experience a severe mental health issue, and 4% will experience mental health issues and a co-occurring substance use disorder. I am one of the 4%, or estimated 13.1 million Americans with a mental health and a substance use co-occurring disorder. I was diagnosed with major depression and have been sober from alcohol for over 6 years. I am public with my journey and my struggles because it is a normal part of the human experience. What makes my story remarkable is how unremarkable it really is. My mother, who is here today, said something to me in my mid-20s, which not only saved my life, but changed the trajectory of my life. In the abyss of one of my deep, depressive episodes, she told me what I was experiencing was simply a chemical imbalance of the brain. And that was it. She helped me to understand for the first time in the simplest way possible that this wasn't my fault or anything that I should be ashamed of. That was not the moment of my birth, but that was the moment that my life truly began. Many people will come through these doors much like me, struggling to manage their depression, challenged by the circumstances that worsen their mental and emotional crisis and confronting their substance use disorders. For many like me in crisis, the light at the end of the tunnel was not the possibility of a better tomorrow, but the light of an oncoming train. This place is a space for healing and hope, for the possibility of a better tomorrow. Those who come through these doors will be treated with the utmost dignity, care, and respect. The services offered here are to help someone live a fuller life. Yes, and they are welcome to come here as many times as they need. We are here to help you. 4 years ago, this mental health access center was just a whisper, just an idea. And today we cut a ribbon celebrating this wonderful new service. Thank you again to all of those organizations and individuals who made this possible. We. Thank you.
Good morning, and thank you so much for joining us today. It has been a feat, to say the least, that we got here. Although I've not been part of this journey for the duration as many of those here in this room, I do have to laugh slightly at a conversation that I remember very clearly during my interview. I remember asking this group of directors and CEOs, so where are you in this process? When do you think this center is actually going to open? They literally told me, probably sometime this spring, maybe March, maybe May. Mind you, my interview was October 4th, 2019. I then asked a follow-up question, what do you foresee me doing for maybe the next 3 months before we actually open? Finishing up a few policies and some overseeing a few construction pieces of it. Well, 1 year and 5 months later, here we are, and we are literally almost ready to open. All joking aside, I am so excited to be part of this team. I had the pleasure of knowing most of them prior and knew about the amazing work they've already done in the community. But I know this Access Center will bring a whole new meaning to community partners working together for the common good of people. I also know a few other things. I know when anyone walks through these doors, that Foundation 2 staff will greet them and provide an understanding that each patient's crisis is individual and will work extremely hard to get them connected to the next step, whether that is connecting them to resources both in-house or out in the community. Ultimately, working towards the goal of allowing individuals to safely return home. I know that when an individual is in need of a mental health counselor, a peer, or simply cannot wait the weeks it normally takes to see a prescriber about medication that they are on or need to be on, Abby is here to support them. I know that when the need for an individual to leave their home to seek a place where they can safely stay until their crisis subsides with assistance, or a safe place where merely more questions just need to be asked to find an answer, Penn Center's here with their vast knowledge and caring nature. And finally, when that small window of someone seeking substance use services is open just a crack, and an individual or a loved one cannot wait until the next morning in hopes to possibly speak to someone who can start moving their life towards recovery, ASAC will be here waiting. I honestly could not have asked for a better team. Yes, there are days where we disagree sometimes, followed by days where we couldn't be more excited to move this project forward. But there has never been a doubt, even through a pandemic or a natural disaster, that we want the same thing, which is a better way, an easier way for people who need it to get the help they deserve. Thank you for allowing me this opportunity to work with you and your staff. Now for the rest of you who had the pleasure of joining us today. If you are standing in this room right now, you've played an instrumental part in the beautiful building that we're standing in this morning, and for that, thank you. I would love the opportunity to individually thank you, but with this small group, even then, the speech would be obnoxiously too long, so I just want to recognize a few. To those involved in our Thursday morning construction meetings, thank you for being literally my only social contact outside my home during the early days of the pandemic. Thank you for teaching more than I would ever like to know about construction, and even more importantly, Darren, thank you for sitting next to me during those meetings and leaning over about every 5 minutes saying, do you know what they're talking about? And when 99% of the time I said, not a clue, having the patience to actually explain it to me. To the small group of law enforcement in the room, thank you for being some of our strongest advocates in the community. Thank you for also being the recipient of many, do you have a second? I have a really random question for you. Recipient of those emails and texts. To David, thank you for trusting this group and giving you a recommendation and hiring me before you even met me. To have a supervisor who you know is always in your corner and who will always step up to the plate for you makes a difficult job like this very manageable. Finally, to Ben. Thank you for your continued support, both locally and regionally. This building, this program, this ceremony today does not happen without you. Thank you for letting me be part of your dream. In closing, this Access Center has not only the opportunity, but now the momentum to continue to reduce barriers for those needing mental health and substance use disorder help. We not only have some of the best providers in the region, but also community support to give every individual who walks through these doors the support they need to live their lives to the fullest. I have heard many people describe this Access Center to be a, quote, new chapter in mental health and substance use services. I actually don't believe that's true. I believe we're literally starting an entire new book. This Mental Health Access Center will be a game changer in the lives for many years to come, and today is just the first page. Thank you. For right now, I would like to invite Ben and the 4 directors and the CEOs to come up with me and cut the ribbon. Slow cut. Ready? 1, 2, 3.
By slow, you meant not fast. Congratulations, everybody.
Thank you.